Hi, I'm Mikal Myers, and I'm with Balance Therapies, and we're going to have a little massage minute here, how to self-massage, and today we're going to use the tennis ball. I love the tennis ball because it has a little bit of give, and it has a great surface area to work with where it won't damage. People use other things, but I prefer the tennis ball.
I have tennis balls.
Oh, and you know what? They're cheap because they're everywhere. Okay, we have Julie that's going to be our model today. Thank you for helping, Julie.
Thank you, Michael.
Okay. All right, what we're going to do here is we're going to start, before we start, let me get back to there, is never put the tennis ball on bone, only muscle tissue, okay? So that's the key. That's really the only rule. You can be as creative as you want to be, and so it's really up. So I'm going to give you some basic guidelines, some basic spots, but then you can expand on your own for your own specific needs. Okay?
Yeah.
So cool. So first of all, what we're going to do is I'm going to reach across, and again, we're going to stay away from the shoulder blade, and we're going to stay away from the spine. And lean back here. Now, what this is for is because in today's, see, good.
It feels good, yeah.
One of the things that we do today is we are on computers, we are driving cars, we're on cell phones, everything we're hunched over. And this purpose here, what we're doing, is to kind of open up that chest to get breath in, to put our head back up onto our shoulders.
Oh, good.
Okay, so you don't want to go, sometimes it'll be a little uncomfortable if you've never done this before, but as time progresses, you'll look forward to it. I do. I have tennis balls in my car, I have them in my office, I have them next to my bed. I drive my wife crazy. I've got tennis balls everywhere. So, anyway.
You're like a tennis pro.
I am a tennis pro. I keep tennis ball companies in business.
This feels good.
Okay, good. Now, what you're going to do is, the practice is you're going to play a game with your involuntary muscles, and you're going to breathe in to where that tennis ball is. It's kind of like your mother going, hey, this place is tight. What you're going to do is, as you breathe to that area, you're going to feel that tennis ball, and then as you exhale, you're going to feel the muscle open up and relax.
Oh, yeah, I do.
Okay, so this is a key thing. So you're just going to do this for 2 or 3 minutes. Since we are going to try to cover the body today, we're only going to just do it, we're going to move along rather quickly. Now, the key as far as this sequence is concerned is you're going to basically do this for 2 to 3 minutes, and then you're going to go down the scapula, you're going to go down about 2 or 3 inches, do that for 2 to 3 minutes, and then you're going to go a little bit further. Now, don't go any further than this, which is just at the base of the scapula, because then you'll get into the kidney area. After you do 2 or 3 minutes at these 3 positions, then you're going to do 2 or 3 minutes, 2 or 3 minutes, and 2 or 3 minutes, like so. Okay?
Yeah.
And now, after you've done this sequence on both sides, you're going to move down to the lower back. Okay, now, all you got to do is just, your parameters are going to be in this area. This is the top of her hip. And I'm going to roll you over, Julie.
Sure.
Okay, from here to here, because then we deal with kidneys. So what you're going to do is you're going to put the tennis ball just at the top of the hip, okay? Actually, right at the base of the spine, but not on the spine. Go ahead and lean over. And this is going to change the rotation of the pelvis a little bit. So this is for those people that have sore backs. And it's the same game. Good. Yeah, this is like when you're a little tight, and I happen to know you have a tight back.
Yes, you do know that.
You know, she's a computer girl, and oh my goodness, always sitting at that computer,
Yeah.
which is pretty much for our society.
Yeah.
Okay, and then what she'll do is, again, the same exercise, 2 to 3 minutes, breathing to the area, and exhaling. Does that feel all right?
Yeah, it's great.
Cool. Okay. And then you're going to move up the spine. You're going to have 3 spaces, all about 2 inches apart. Okay, and that.
Could I move down?
What you're going to do is you're going to move the tennis ball up the back this time.
Oh, okay.
So everything's
So
moving
that's
towards
not
the center.
The kidneys won't be there?
No, kidneys are about here.
Oh, okay.
Okay? They're there.
Now I know.
Now you know. Okay, after you do this, what you're going to do is you're going to move down into the glute area. Okay? Now, you have the little diamond-shaped sacrum, which is here with the bottom of the spine, and you have the hip up here. You have this whole area to work in. And I got to tell you, this is a marvelous area for relief of both the lower back and also the lower leg, the upper leg. Okay?
Oh.
Now, this feels pretty good, and you have a lot of area to work with because there's not a lot of bone that's exposed in the lower glute area.
That's nice.
Is that good?
Yeah.
Okay, and so you can play around even If you're feeling a little bit tightness on the side of the leg, you can even just slightly come out a little bit as I come this way, and you can even put a little intention like so.
Oh yeah, that's
Okay, and that'll really open up the hips.
Oh, I like that.
Okay, good. Okay, come back here. So this is the back from the shoulders to the glute. Now we're going to try from a sitting position.